Thank you so much.
You're most welcome.
Yeah. Welcome back to IGH. I am here with Dr. Ismail. Doctor, welcome once again to Kerr Fatou.
Thank you. It's always a pleasure when I get to see you guys around.
You know, I've been here a couple of times, but you're always busy and I don't always want to disturb. So I just sneak in, do my consultation. But how has it been 1 year after our visit, 1 year, some months after, establishing this magnificent business? How has it been?
I think it's been a long year. The 1 year, sometimes it feels like 5 years.
Yeah.
Because so many things have happened.
Yeah.
And more than anything else, the company is evolving constantly with the demands of the market. So more than anything else, the first year allowed us to learn.
Yeah.
Learn a lot about doing business in Gambia, but also learn a lot about internally what company we want to be.
Yeah.
What do we want to be known for? Do we want people, when they hear Innovarx Global, to think quality, to think innovation, to think service, but more than anything else, to think assurance, peace of mind, meaning anytime you enter the facility, whatever service that you have,
Yeah.
it gives you a peace of mind knowing that it's what you need.
Yeah.
Right? But the interesting thing about that is that comes with a lot of responsibility, because you make a promise to the people
Yeah.
that this is what we stand for. So internally, you have to always be reflective and hold yourself accountable to what it is that you're selling, which is a promise. And I think 2020, with all the challenges, all the growth, the company has always been intentional about trying to be better. Not only once, but every single time.
Yeah.
So I think a lot of people like yourself that even knew the company in the beginning, even people in the diaspora, their experience then and even their experience now, it's a different company. So it's been a very interesting year. And what I normally tell people is Innovarx Global, from the outside, it's a healthcare solutions company. A lot of people struggle to define what we are. Right? The easiest way to define it is we use technology to help people get or stay as healthy as possible by delivering quality healthcare services in the most convenient way. That's the umbrella of what we do.
Yeah.
Some people, it could be retail products. Some people, it could be pharmacy products because they have a chronic condition.
Yeah.
But the end goal is, how do we democratize access to quality healthcare? But also internally, I don't think we're a healthcare company internally. I think we're a human development company internally.
Yeah.
Because in 1 year, we've hired 52 Gambians. Our staff is 52 Africans.
Wow.
And Africans, because we have representation from across the region. That's a huge undertaking.
For 1 year.
It's a revolution within the company, because to us, we wanted to be that, where you come in, you see young African faces. But even for individuals like you see the development that's happening within staff. Our nurses now are using electronic health record systems routine.
Yeah.
So now they're on the same level field as a nurse in a national field.
Yeah.
All the different fields, were forcing them to be uncomfortable and grow so that we could always be something that Gambians like yourself could be proud of. Is it easy? No. Because for a young company, any person that I say, okay, our payroll budget is $500,000 a month on payroll. For a young company, it doesn't make sense.
It does not.
But what I tell people is, it's bigger than healthcare. We have a lot of young, talented Gambians that we need to invest in them by giving them opportunity, create an environment where they could grow while you hold them accountable, but also pay them a living wage that restores dignity back into the community. Because for every IGH employee, there's their mother, their son, their children that they have to take care of. So the healthcare, I think we've made a lot of impact. But for me, that's what I'm most proud of. The human development element of it as well.
So for me, for a young company, 1 year into the business, obviously, healthcare provider, 2020 has been a difficult year for us, but more so for healthcare providers. And one of your areas that you specialize is the wellness on wheel, where you go visit people at home. But I think personally that you had a surge during the COVID period because no one wants to visit the hospital. Everybody stayed home. And as a small business, this is something you specialize. How did COVID push you? Did it affect your customer care? Because now you had more patients to go see. You have more customers to look out for. How did you manage the challenges of COVID and be able to also safeguard that quality and assurance that you always want to keep for customers?
It was a challenge because I think it was the first stress test for the company in two ways. One, do you have a good idea? A lot of our business plan, when I tell people telemedicine was part of the business plan, wellness on wheels was part of the business plan, point of care testing was part of the business plan. All these things that now, even all over the world, healthcare companies, because of COVID, have to add these elements to their business when that's how we were created.
But you were created that way.
Exactly. And I think I don't think coincidences happen. Like opportunity, preparation.
I remember when we first had this interview, you said, Fatou, this is the future of medicine.
It's the future of
telemedicine is the future. And a few months into that, everyone was tested. But you were prepared for it.
Yeah. And also what it did was it gave Gambia a sense of reality. What happens when even the wealthy can't travel? That's what COVID did.
That's what it did.
People who could run to the US to get medications couldn't travel. Right? Locally, people were struggling with getting access to medications. Everything was in shortage. So it allowed us to introduce ourselves to the country and the region as solutions could come from within. So that's what COVID did. It added a lot of stress though, because the demand increased way more than a young company could handle. From an inventory standpoint, it was capital intensive. The training human element growing fast. So that came with a lot of challenges, but it was an opportunity for us to see who we were, but also validate our position in the market as people who are willing to stay and provide the care that people deserve as well. So it was both ways.
Yeah, and I know we had a lot of COVID talks during the tense period on our platform, Let's Talk COVID. It was very helpful. A lot of people would say, "Can you bring Dr. Badjie?" Because people were scared. People needed to know what they should do. I remember staying home 2 weeks, not leaving my house because I was worried. And I had anxiety. And, when we had my first show, and just listening to you and giving me the prep talks, what I need to take, what I need to do, like some of the things that were available locally, it helped to empower me. And that was helpful when we did that. But I do know that there was so many other people, that information that I got helped me also prepare my family, my friends. There were so many of my friends, people that were infected, people that had the hospital were not able to take care of them. We had to recommend from them, got them isolated, and we got them proper care services.
Absolutely.
I want us to talk about your IGH healthcare, how do you call it, plan? Because
the
care plan is my go. That's my everything. You go to my house, I think I have a pharmacy there. It was very helpful. To all my friends and relatives, it was really helpful. And up to now, this is what people need to know. They need to have that at home. Everybody should have a healthcare plan when it comes to COVID. Yes, vaccines are here, but how many of us have access to that?
No, absolutely. And that's something that the moment COVID hit, we figured you could either have multiple conversations with multiple people who have the same problem. I have COVID. You have to manage the symptoms while your immune system does the rest while in isolation. So we figured, let's create a COVID care package that our doctors, our general practitioners, our pharmacist team sat down and formulated everything somebody needs to recover fast. Rehydration with electrolytes, fever reduction agents, immune boosters, a thermometer, and package it in a way that now we could just replicate the same information to a lot of people that needed it. But more than anything else, with Wellness on Wheels, encourage people to stay at home and the product deployed directly to them. That revolutionized how people consume healthcare. And I think even after COVID, what our model does is it makes people realize that one, healthcare should be preventative, not emergency all the time. Our health systems are overburdened because a lot of times Gambians don't believe in preventative healthcare. So things like the COVID, care package, it's designed to help you recover. But even additional plans like the wellness screening, where we're encouraging Gambians, come get tested, come get an electronic health record system. Even any doctor that you go to that you present an electronic health record, you've made their job easier because good information allows them to produce good work. But COVID just allowed us to infuse a lot of those elements into the market. So it's been good and it's still ongoing. That's last year and people are still having COVID. So the need is still there.
The need is there. And, I know that we can always have access to most of these things here, especially the mask. I saw Salou Tal, the president of the Gambia Press Bar Association was here, and he was also talking about the cost. I think for a lot of us, is the customer service, because extra customer care delivery. We just treat everybody just like, here when you come in, you don't have to be Fatou Touray or Dr. Badjie or Salou Tal. You walk in, you're treated like a customer. Everybody is treated the same. And I recommended a friend, and he was like, do you want to call Dr. Badjie? I said, no, I don't have to call Dr. Badjie. The system is designed in a way that you walk in, you get your services. I don't call Dr. Badjie myself because I know when I go there, I'm treated. So how do you manage that to make sure anytime anybody comes in, everybody is treated the same?
It's a company culture. When I was coming home with this idea, so many people told me that Gambians will spoil their business for you. It's a good idea, but dealing with Gambians, they will bring the business down. So internally, we preach the message that everybody expects us to give mediocre service. Or even if we give good service, we can't give good service all the time. So now we're going to fight with our own tendencies to be something different. Because especially Gambia being that good service, normally you're either non-Gambian or a Gambian of privilege. But dignity is universal. So we believe that dignity should be democratized. But more than anything else, it speaks a lot more if a Gambian feels like a fellow Gambian is providing good service irrespective of who they are. That's our internal revolution. I talk about it all the time with the staff. Most people don't expect good service. But how do we do it consistently to show people that for us to get better, we have to be better? And it's become a company culture. It's difficult because it's a constant negotiation with human beings. There's so many elements. But I think that's what we want to be about. A company for Gambians or Africans, by Gambians or by Africans, but not only do it once, let's do it all the time, and then it becomes infectious. And I think I couldn't be more proud of the staff that I have. You've seen the amount of young talent that I have. You've seen them. It's just, it inspires me because they represent everything that I knew we can be, and I know we could be even better. So that's the exciting part.
That's the exciting part. A lot of people, when you advertise for businesses like this, and they'll say, oh, is for the rich people. Just talking to your Fatou and Tijan, they're telling me they all go all the way to Basse, to Kaul, to offer services. And I'm thinking, how affordable can that be for people in the upcountry?
It's a decision that we're a for-profit. Every business is in there to make revenue because that's how you stay. But we also figured out, when I was coming back to Gambia, very often I saw reputable companies that did not have a corporate social responsibility. We figured that if we want to show Gambians that we are committed to their health and well-being, we have to choose which elements we could remove that are barriers. Cost and transportation are one of the biggest barriers that most Gambians face. So the fact that my team now they're going up country with What's Your Number, we are meeting Gambians in their 40s, in their 30s, who have never checked their blood sugar, who have never got a routine blood pressure check. So when we see things where most Gambian men are dying at the age of 60, diabetes and hypertension is growing, it's because access is not there. So it costs the company money.
Yeah.
Investors will even tell you that's not a wise decision because you're losing money. But for us, it's our promise to the country that health and well-being, we're in the business of providing healthcare solutions. And what I say to that most of the times is sometimes telling you, Fatou, we don't have a solution for you here, but go somewhere else. That is a solution. Yeah. So there's a level of knowing where we could stop, where Sinkatan from La Elo, what we could do. And also that's how we integrate with all the health systems where now, even if you come and do a health screening and we find out, okay, you need to see a specialist. When you're going prepared and the specialist is prepared because there's good information going. Yeah. So those are the mindset, but just removing barriers of access. And it's been a very, very good journey for the healthcare professionals as well to see the disparities in health. Yeah. And for the diaspora, what it's doing now, it's allowing their loved ones to stay in the villages, but still receive the same level of care as somebody in another country. That's a revolution in healthcare that changes the entire landscape. And it's just something we're extremely proud of.
So yeah, that brings me to my next question, the diaspora outreach. Because I know a lot of people in the diaspora who would want, who would take their parents to America or the UK for treatment because obviously we didn't have something like this. And now they can channel all of that too. Especially during COVID. Yes, you might have the money, but there's no access to travel. So how is the diaspora outreach right now?
We're a company that's diaspora led, because I am of that.
Yes.
I used to be the person who had worked as a healthcare professional in the US, and my mom who lives in Gambia has diabetes and hypertension. Yeah. But she never consumed Gambian healthcare because I got medications for her in the US. I was trained to do the point of care testing, so when she comes over, I could tell her what's going on. There were many people like that who did not have an Ismail who's a pharmacist in the US. So when we started, the diaspora was a community that we wanted their attention, to let them know not only are we providing quality services, but everything we're doing, all the products, we're getting it from the United States and bringing it where now we want you to trust the care of your loved ones on us to provide services. Yeah. And sometimes going back to information, just so that you could know from a diaspora standpoint, what is going on. Yeah. So the fact that you could send your loved one and purchase a wellness screening, for example, and then we could call you or send you a report with the patient's consent of what's going on. Now it's a different relationship from Western Unioning somebody money and not having any answers. Yeah. So it's also a system that's built on accountability with our e-commerce platform. There's transparency in what we do. And for our care plan, for example, people always say, $760, who could afford that? Yeah. My answer to them is, how much is a plane ticket?
Over $1,000.
Right?
Yep.
So for $760, you get a comprehensive screening. Anywhere in the Gambia, you could get monthly prescription medications delivered to you. Gambia doesn't have a lot of doctors. Now we're doing telehealth services where we're using technology for consultations. So we're bringing all of that to your home. So healthcare cannot exist without you paying. Yeah. And prevention is always cheaper than most people who have to run to Dakar. Yeah. And that doesn't always mean good outcomes. So I think it infuses more trust in the system. And Gambia now is starting to have a lot of healthcare professionals who are global healthcare professionals who are choosing to perform in the Gambia. Right? So from our orthopedic surgeons, for example, like that, that's a global doctor, just an example, who's choosing to perform in the Gambia. It's different. So we have to also change our mindset that value could be created and consumed here. Yeah. So the diaspora, that's why we listen to the diaspora too, because they have a level of expectation when it comes to service. Yes. That doesn't make room for excuses. They pay, they expect a service. So for my staff, they're now understanding the psychology of the American consumer, meaning if I'm paying my money for something, you have to be consistent on your product. So I think it's a challenge we welcome, but the diaspora, I think we are positioned to continue that relationship with them to make sure we can just help their loved ones stay as healthy as possible.
Yeah. So if for those, for our new diaspora viewers who maybe want to register, what's the process like?
We've simplified the process. What our e-commerce platform did, IGH.GM, it made it where anybody in the diaspora, be it a care plan, be it a comprehensive wellness screening, even if they just wanted to purchase some Colgate for somebody in Badjie, you could go on our website and literally purchase it, and Wellness on Wheels will deliver it. But from a clinical standpoint, we always tell people in the diaspora, start with a foundation, which is our comprehensive wellness screening. It's a 12-test exam that gives them an electronic health record system, screens them for diabetes, hypertension, their kidney function, their liver function test, their electrolytes, their vitamin D level. That comprehensive screening, we designed it as a foundation where any institution you go in the world, that's information they need to do anything else. So that's step one. If they're healthy, fine, you've done the screening. For individuals who have chronic conditions, diabetes, hypertension, high cholesterol, that need continuous management with medication, that's where the assurance care plan comes into play. Where now you could purchase that, they'll do their screening, they do a consultation with a physician, and every single month, their prescription medications are delivered anywhere in the Gambia. And what that does, Fatou, is and now I'm speaking as a pharmacist, is it increases adherence. Diabetes and hypertension, the cornerstone to people living longer and staying out of the hospital is, are you on the right medication all the time? And also every so often, you're coming in to check to see where your disease is. That way either they could increase the medication regimen or optimize it, or some people who are doing well, they've lost weight, they're exercising, sometimes it could go the opposite direction, where some people with diabetes start coming off of some medication. But it allows that continuity of care. And Innovarx Global Health, why we call ourselves a healthcare solution is, once you enter the gateway, there's continuous monitoring of where you are just to keep you outside of the hospital. That's always what we aim to do. If anybody who has diabetes and hypertension, how do we prevent you from being hospitalized? How do we prevent you from getting your leg amputated? So we're removing all the barriers, and now people in the diaspora have peace of mind, knowing that, okay, I know what's going on, but also I know where my money is going. So those two elements, starting point, comprehensive wellness screening, especially for people who haven't seen a health system in a while. And then the ones that need management, that's where our assurance care plan comes into play.
You know, I have seen you guys partner with other health facilities, especially Bundung, providing them the Augusta. I've just told TJ, and I think that's my favorite, you know, part of your service, you know, having a proper record system where people can always have access to their medical records. So tell us about your partnership with other healthcare providers.
Most people that know, Augusta is the one element of the company I'm most passionate about. Because it stands to, it already has revolutionized healthcare in the Gambia. Our institution, we have never operated on manual records. Every single patient that has ever entered Innovarx Global, if you call us right now, we could email you a report of every single clinical encounter that you've had here. So when we brought Augusta to the African market, we decided not only with public institutions, but private institutions, we should move to the era of healthcare where a scribbled paper should be a foreign element. But also what it does is it's increasing capacity of nurses, where Bundung Hospital, for example, when we met Bundung, they were the most ready from our analysis. Their whole net computer was connected. The management was on board. We told them, we're not going to tell you we're going to sell you Augusta. Give us the opportunity to implement it free of charge, to train your staff free of charge, and show you what it can do. Where now the antenatal cards that women are getting, it's digitalized. So you could go through the entire Augusta ecosystem up until pregnancy, and everything is recorded. So even 15 years later, if you want to know what happened during your pregnancy, the records are there. So Augusta is a product not only from a public sector, from a private sector. We want to encourage institutions to collaborate with us, to help us help them in terms of using data, which is the future of healthcare, and making it a standard. So we have nurses like, Ida Jallo, who graduated from nursing school, and she started working with us. She has never lived in a world where she doesn't use electronic health record systems. So the human development that's happening, it's mind-blowing. And I think for electronic health record systems, for Bunung, for example, the reason why it's successful, our nurses are training their healthcare professionals. So there's a level of trust and camaraderie when a healthcare professional is implementing a healthcare system versus somebody who's technical, like a software developer, trying to teach a nurse who's never used electronic health record system on how to use a tool. And I think that's why the success at Bunung is something I want the world to know about, because it shows that everybody will tell you why it cannot work. But I think we have to move to the era of Gambia or Africa that we persist on why it will work, however long it takes. Internet is down sometimes, that's fine. We keep on. We use AfriCell backups. We use QCell backups. The work continues. So Augusta could really, for us, Augusta is an Africa project. That's why when I made a relationship with Augusta, I told them, I don't want to buy this from you. I want us to build a relationship where Augusta and IGH becomes an entity in Africa. So that's the relationship we built. We're rolling it out in the Gambia. I think there's a lot of private institutions that we could make it relatively affordable.
That's what I was going to say. Is there any plans to roll it
Absolutely.
to other?
At this point, any place that you're seeing patients, you're Augusta ready. Systems like the vaccination programs, the testing, any institution that wants to go digital, I think what most people spend on paper alone covers for a cloud-based system that allows you to have a wellness on wheels, because my guys are in Basse. And even if they check somebody's blood pressure in Basse, the same instant, we see it on the screen. That's the future of healthcare.
That's the future.
We can't run away from it.
We can't run away. COVID have pushed us all to that. So I think Gambia should try to be ready. So, but I recently saw this announcement, the Startup Health.
Startup Health,
what is this all about?
So the Startup Health opportunity is really exciting, and I'll tell you why. So Startup Health, they have these moonshots where access to care, for example, is one of them. Where they identify budding companies in the healthcare space that are startups that show promise in delivering these moonshots of increasing access to care. So when we saw the opportunity, we put in a bid, applied, went through a long due diligence process, and we got accepted. So what happens is they give you a token investment, but also they prepare you to go scale. Because for us, it meant a lot, because the Gambian ecosystem has always been known to not be friendly for businesses. We don't attract venture capitalists. A lot of startup companies don't get to a point where they become a regional entity. I think we can be that from a healthcare, because I think our solutions are not a Gambia solution. We were intentional about Gambia being the place that we tested it. 2.5 million people. You could go Banjul to Basse in a day. But Startup Health for us was just a great opportunity to align with a global entity of like-minded people who just want to solve human problems. So it's something we're extremely excited about. The journey is just beginning with them. And I think for Gambia, it puts a good light. So we represent the Gambian people to them. We represent the Africa continent to them. And I wish by us being on that global platform, it'll give confidence to people in the diaspora as well that have any idea that Gambia, you could start in Gambia with a global idea and then venture out and still keep it on the same competitive level as any company in the world. And I think that's what Startup Health did for us.
That's interesting. Congratulations.
Thank you.
So finally, before we go, what do we expect in the coming years, like next year especially? When I come here next year, what do I look at? Where will we be at in the next 1 year?
Constantly evolving. I think what we want to do with technology, Fatou, we're just scratching the surface, to be honest, because of the human element. And I still go back to the human development part of it. We have to invest and infuse confidence in young Africans to deliver things of value consistently. So what's coming is, how do we keep pushing the envelope with technology to reach more homes, not only in Gambia and Africa. We want to be in a sub-region. We want to get to a point where you could be visiting Ghana or Nigeria and use an interconnected system of healthcare where your doctor could still be in Banjo and you use Augusta and the communication happens. So growth. We're at a phase right now where internally, continuous improvements, continuously holding ourselves accountable. We believe in using a mirror with the company. How are we doing? What are we doing to improve? How are we being better for our patients? So that's going to continue growing, investing in Gambian professionals, paying professionals a living wage, even if it's 20, 30% of our revenue. We believe in that. But technology, I think I'm excited about some of the things that we have in store with technology. We want to strengthen our relationship with the local ecosystem. That's something I still wish could be more in terms of just being integrated, working hand in hand with all the stakeholders so that they don't see us as competitors, but as collaborators. It doesn't have to be only one. It could be many, because then it just increases value. So yeah, that's what's coming. It's really, really exciting. Our company is growing very fast internally and with opportunities. And I just hope we still keep it where we give people that look like us the care that they deserve all the time.
All the time.
That's the goal.
Thank you very much, Dr. Badjie. And finally, to your clients, especially the new patients who are looking forward to walking through this door. They don't have to worry about the bills, right?
No, they don't.
It's affordable. I walk through the aisles and I see $150 or $100. I'm like, really?
It's inexpensive. I think there's a myth that something that comes from the US is expensive. But what makes products expensive is how many hands is this exchanging with middlemen before it arrives to the consumer. So what good relationships do, like our quality choice relationships, we're buying directly at the same places that local pharmacies in the US are buying, so we could bring it and still be equally competitive. And I think more and more people, I always urge people, go on our website, see a product, then go on a US website and see a product. It's actually cheaper now to consume, get a lot of tests done here with medications than it is in the US. But I think something I have to mention, Fatou, is I have to thank our early customers, yourself included, for being patient with our growth. For me, you know how I am, I'm always asking for feedback. Because I know what intentions I have for the company delivering a level of service. So anytime people that are early adopters in your business and they stick with you through your growing pains, to me, that's a value and level of gratitude I don't take for granted. And these people are people in the diaspora who probably knew me on a personal level. And they're giving us time to constantly improve and get better. So those are the people I always want to make proud. People like yourself, people who supported us in the beginning and know that Gambia is a very difficult terrain for a startup to thrive. So I just have to say thank you to them and for them to just keep watching, because I think we're really, really excited about what's coming for the company and for them.
And I think all of us are excited too, because it makes life easy for all of us. For me, I hate going to hospitals. So sitting in my office and getting all my tests done at my office, getting my grandmother's medication delivered to her every month, because sometimes like her medication is finished and I don't really have the time to go pick it up. But with you guys, they know it's time to get her medication delivered. That makes it much more easier. It's worth everything.
It is.
You know, if you have patients like that. So those are the things that really encourages me and so many other customers. And I just hope you guys continue on that.
It helps the hospital systems. I think my level of reverence, respect, admiration for Gambian healthcare professionals is so high. That's why anytime I hear people say something negative about Gambian healthcare professionals, I stop and tell them, you don't know how much these people are doing with so little. So the more institutions of quality that exist that cover preventative services allows them to do their job with less burden. And I think that's something I've always been grateful for, the relationships that we have with local healthcare professionals. Because Gambia has been tough, and we haven't seen any time in Gambian history where our health system is
prepared for anything.
But we have some of the most resilient healthcare workers, and they deserve a lot of praise.
And it's been really tough, especially during the COVID period.
Very limited resources. They perform magic. That's what I tell them all the time. A lot of our healthcare professionals perform magic and still wake up every single day and choose to go back to work.
Choose to go back to work.
It takes a special human being to have that dedication to humanity. So yeah, it goes definitely a long way.
It does. And we want to thank all of you for your services because this has been a tough year. And whilst we are staying home, you're always there at the front lines to look after all the patients. And we want to thank you very much. And I want to thank you and your entire team. This has been home for me and my entire family.
Absolutely, from day one.
Yes, and because also we get good service whenever we come. My uncle, we almost, I remember calling you. I was called, he was not even able to walk. It was really tough for the family. And the first thing I thought about was you, because we could not take him to the hospital. Your team went to visit him. And today I can proudly say he's doing amazing. Yes, he's recovering, he's doing very well. My grandmother, your team always visit at home. So these are the kind of things, stories that we want to tell. And it's encouraging that we can have a service like this in Gambia, not even in the US that you get this kind of service.
I tell people all the time, not even in the US.
Not even in the US.
Yeah, not in the US.
Not even in the US. So something like this is really something I proudly take pride in, in telling the stories, because I think it's important for people to know the kind of services you offer, but how also it's impactful in our lives. People like me are busy, but we can always take care of ourselves.
You guys covered.
At home,
Definitely.
Yeah, thank you very much. And
thank you so much.
And I want to thank your team, Hadi, Tijan, and the rest of the team for always, working tirelessly to get us